Complications from plastic surgery are relatively rare. They do occur, not infrequently, however, and the incidence of them occurring probably is greater than the 1 to 6% that is reported in the literature. You may be one of those patients who just recently had a procedure where you're dissatisfied with the outcome. And I can understand you're being upset and bewildered and obviously maybe even a little depressed from the experience. But I'm going to help you navigate through this process and give you a pathway to find the right surgeon and the right approach and the way to think about how to fix your problem so you end up with a satisfactory result that meets your expectations. I happen to be a cosmetic and reconstructive facial plastic surgeon, and I've taken care of many revision cases which haven't gone well. The safety of the patient is paramount. No surgeon or patient goes through surgery expecting to have a complication. There are many well-trained, very competent surgeons who have thought out the procedure to the last degree, and yet complications do occur, unfortunately. When that happens, you as a patient and the surgeon, believe it or not, can feel terrible that things have not gone the way they planned. Sometimes complications occur because patients have pre-existing conditions or habits which can predispose them to increased risks for a complication following surgery. Specifically, if you smoke, if your blood pressure is high, if you're diabetic, if you take blood thinners, all those things and others can predispose you to complications that sometimes can be controlled prior to surgery, but sometimes things happen intraoperatively that we can't control for, and they may lead to a complication and an outcome that you're not pleased with. Of course, we're not going to blame you for the problem. That's one thing I have to emphasize. You're not to blame for the complication. Sometimes the surgeon themselves are not to be blamed for the complication that occurs. Things happen that are out of their control. But very often, even surgeons who have amazing training can fall into complications. And this brings me to the idea that not every surgeon is a jack of all trades. They may do breast one day, they may do abdominoplasties one day, they may do eyelids one day, they may do a facelift one day. But in the end, they're not experts in all areas of the body. And therefore, when you seek out a surgeon who is going to perform a particular procedure on you, they should be experts in that particular area. Don't seek a surgeon who claims that they are experts in everything, because in truth, there are very few people on the planet that are experts in everything. So I would seek out a specialist for whatever condition or problem you may have. So complications can occur in any region of the body that the surgeon operates. Obviously, in abdominoplasty, you may get a hematoma or seroma, or deep vein thrombosis. On the breast, you may have capsular contraction or a displacement of an implant. And on the face, where I am more familiar with the complications, I see eyelid contraction, I see scars, displacement of the ear from facelifts. All these things can occur. But in the end, it's emotionally creates a disorientation. The patient is extremely upset, of course, because they didn't plan on this or think that they would ever end up with a complication. It is so critical that the surgeon that you have has empathy for your situation and doesn't throw up a false curtain of guilt that you have caused the problem. Okay, that can be an issue. So it's very important that the surgeon put aside their ego and their sense of credibility and see you as the centerpiece of the problem. You are the centerpiece. You have to be the centerpiece. Your problem is the centerpiece. Don't focus on compensation or financial issues. Focus purely on your problem so that you can end up with a positive result that you had planned on and expected from the get-go. I feel that too often the surgeons blame the patient for their problem and not really focus on the problem that has occurred. So what are the steps to help rectify the problem? First and foremost, go back to your surgeon who operated on you. Have an honest, direct conversation about not only what happened, but what his thoughts or her thoughts are regarding how they're going to fix the problem. If you feel any hesitancy, you should seek a second opinion from an independent specialist, probably not recommended by the surgeon himself, but by looking on the internet or some other source for a second opinion so you can get an independent, unbiased opinion about what to do. It's my hope that your surgeon has your best interest in mind. That's number one, okay? Because their plastic surgery outcome is a reflection of their abilities and their confidence in themselves, and that can sometimes run against your interests in terms of getting better. So you have to understand that there's some ego involved here, and those surgeons have to put aside their ego because you have to be the center of the problem and the center of attention, and nothing else can get in the way. In my experience, insurance companies will compensate you for revision surgery if there's some functional or deformity that occurs as a result of the surgery. However, if there's purely a cosmetic procedure that comes out in a way that is not impairing your function, then the insurance companies are usually resistant to paying for those revisions. That means you may have to swing back to your original surgeon to see if he is willing or she is willing to foot the bill for the revisions with the secondary surgery that occurs. That's something that really has to be discussed directly with the surgeon, and it may be a unique situation. I myself have been compensated by other surgeons for revising eyelid and facial deformities, but that doesn't always occur, and that's something you really have to discuss with your original surgeon. I know that if you've experienced a complication that is very emotionally draining, very disruptive, and can disrupt your social life and your professional lives. However, I have to emphasize that you must be patient. Patience is key here because it takes quite a while to work through the steps to revise and fix your problems, depending on the degree of deformity that exists following the surgery. So just be patient. It's very important you be patient through this whole process. I hope what I've explained to you helps you navigate and think through the process itself. And if you have any further questions regarding the process in which you go through revision surgery, please leave them below. Subscribe to my channel if you have any further questions, and I look forward to seeing you in my future videos.